All right, it's SMX medical update time. We bring in the good doctor, Joe McGinley from the McGinley Clinic. A couple different things to talk about this week. It started actually before the Seattle race, where RJ Hampshire took a handlebar to the boot. And normally these boots, it's unbelievable the impacts you can take without injury, but he got it just right, where he ended up with a foot injury and did need surgery. So what are you thinking there for RJ?
I saw the images. Yeah, there's a fracture of the midfoot. Now, fortunately, it's one of the lesser digits. It's not the main toe, the first toe. Had surgery on that. That's going to take some time to recover. As we've heard with Jet Lawrence, when you have surgical hardware in the foot, you can't come back too early because there's a lot of stress on that hardware. That hardware can then break, and then starting all over again. So in this situation, likely the correct approach, putting the hardware on there, stabilizing that fracture, and now letting it heal. That's going to take probably at least 6 weeks for that to heal out. It's unlikely that he'll come back, before the end of the Supercross season. But again, with some of the treatment and healing methods, it's possible, but unlikely.
Okay, and then bummer news here for Jorge Prado, who'd been riding unbelievably well. I think at first people said, just get through Supercross and don't get hurt, because it looked like that was the only goal that was attainable for him. We didn't know he'd be going fast and qualifying P1 and winning heat races and getting podiums. But now it might be back to square one. So he hurts his shoulder, tried to line up in Seattle, couldn't. We believe he's dealing with a AC joint separation, the separated shoulder. Talk about the grades and what an athlete has to deal with to try to decide if he can still line up.
Good. Well, I think, again, we've had this topic multiple times on dislocation versus separation. So hopefully everyone's in line with that one. So for the separation, we're talking more your AC joint, so where your clavicle joins your acromion on the top part of your shoulder. So that's what we're talking about with the separation. There's 6 different grades, and the grading depends upon the ligaments, how much the ligaments are damaged, the stability of the joint, and whether the bones have physically moved. So in the ideal scenario, if you have just partial ligament tears or a lower grade tear, you can get that stabilized. You can use conservative treatments and get back out there sooner. If you're more in the 4 to 6 range on that grading, that's where there's instability. In that situation, the shoulder's not functioning properly. You're going to be unstable. You're not going to be able to manage the bike out there. That will require surgery and, unfortunately, a long recovery time. So MRI and diagnosis is critical in this situation, along with the clinical exam. So the MRI will tell you if the ligaments are injured, and then the physical exam will tell you if there's instability. If you have both ligament injury and instability, that's going to suggest surgery.
One other thing to discuss here, Joe Shimoda back surprisingly quickly. This was a very significant neck injury suffered in November, and he is planning on racing this weekend. That's faster than I think most people expected. What are you thinking?
Yeah, I'm a little surprised as well. So, this was late November, and it was his lower cervical spine. He had fractures and surgery on. So obviously the recovery has gone well, and he's feeling good. But it does take time for those bones to heal, especially with hardware in place. So yeah, without seeing the images, it's hard to say. I'm sure they looked at it. I'm sure they're confident that that area is stable. But is there some risk with it? Absolutely. With any of these injuries, the pro athletes are pushing the limits on what we can do in medicine. I see it with my patients. I'm sure every physician that's taking care of a pro motocross racer is dealing with the same conversation. So, for this one, we'll have to see. If he has no crashes and he's out there, great, fine. The problems will come in if he does have a significant crash. How stable is that hardware? How stable are those bones? Again, there's no return to injury without some risk associated with it. But it's great to hear. Obviously, he's confident. His doctors are confident, and he's feeling good. So that's great that he's recovering this quickly.
Yeah, I think really the question is how much will it affect everything else, his riding, his fitness, and all those other things. I cannot imagine they would send him out on the track without knowing the neck is okay. But this short timeline then means that everything else is compromised, and we'll see how Joe's able to perform if he can line up as planned this weekend. Well, that was a little more information than we probably wanted to have to talk about in 1 week. Maybe it'll be cleaner next time.
Absolutely. Thanks, Leach.